Joining us from Miami is Dr. Aileen Marty, a professor of infectious disease at Florida International University. Doctor, thanks for being with us today.
Pleasure, Jonathan.
So it turns out there's a lot that we don't know about Ebola. How surprising were these findings to you?
Some were more surprising than others. Some was information that we did actually already know. Where would you like to start?
Well, you tell me. I'm struck by the nurse in the UK who is now dealing with Ebola again. That seemed to be a major surprise to a lot of doctors, yes?
Yes, that one is very surprising because it is apparently a resurgence and not your typical post-Ebola syndrome that we see in a lot of patients. And it's alarming at various levels. Number one is the way in which she manifested the disease this time is distinctly different than the way a patient normally does. So it was harder to recognize what was going on. And
wait, how did it manifest differently? What happened?
She has a meningitis type of syndrome, and she didn't have the usual nausea and vomiting prodrome that we see in someone who initially gets Ebola.
So is now the concern that people who thought were cured of Ebola may not actually be cured and that we could see a resurgence of the virus? Well,
that's the big question from what's happened to Nurse Caffergy. And based on what we now know about her, there's a number of individuals in Africa that have had similar types of presentation where the studies weren't done, so it's quite likely that this has been happening and we just were not aware of it until now.
So we're also hearing about this man who transmitted Ebola to a woman via unprotected sex. Now this happened apparently 155 days after he had been declared Ebola-free. How does this change everything we've known about this virus?
Well, we've known for a while that it can be in the semen for prolonged periods of time, and there have been prior reports that were epidemiologically suggesting that it could be transmitted by sex. What's different now is that they've actually done a very careful genetic study of the Ebola virus that was in this particular man and compared it to the exact Ebola virus that infected and killed the woman he had unprotected sex with, and it was absolutely unique and identical. And therefore, it's no longer a, well, we think it might happen. Now we know it happens.
Now we know, and now it's confirmed. So does this mean that we should be afraid of contracting Ebola from people that were thought to be declared Ebola-free?
Well, for the most part, someone who's a survivor, and survivors of Ebola have a lot of things that they have to deal with, including a lot of post-Ebola symptoms and so forth that can be very harsh on their lives. But generally speaking, the virus is not anywhere that is easily transmissible to other people. Most people clear it entirely as far as we can tell, although there are some unique sites in the body that are immunologically privileged sites, and those sites are places where the Ebola virus can stay, like your gonads, like the joints, like the brain, the spinal cord, and of course, if it's in the gonads, it can go into the semen. And now that second study that you mentioned earlier has demonstrated virus in some people. In fact, 25% of the people that they had studied 9 to 7 months later still had evidence of Ebola virus in their semen.
So help me understand, Doctor, do we have a clear idea exactly of how long the virus can stay in a body and how long that person may be capable of transmitting the virus to other people?
No, we don't. What we know is now that for sure it can last in the semen for a minimum of 9 months.
Minimum, but it could be longer, correct?
Yes, it might be. The study needs to go on, absolutely. It's just that this particular study was released after they had the longest person that they saw was one individual that had 10 months post-Ebola. So, and that person was clear, but that doesn't mean that other people don't have it for longer, because there were still individuals that were only 9 months and still had evidence of Ebola in their semen.
A horrible disease that is still presenting a lot of troubling questions. Okay, Dr. Aileen Marty from Florida International University, thank you for your time tonight.
My pleasure. Thanks, Jonathan.